move to the next slide. And this is where I was talking about the risk factors. So, the risk factors are again very different. When you have those high income countries, there are associated risk like, diseases and age group of the mother, the teenage pregnancies, those kind of things. And in the low and middle income countries, again, the risk factors may be pretty different. It's the domestic violence, the poor socioeconomic status, even the nutrition status of mother. Like in India, especially like in the states like Bihar, UP, where it's still the teenage pregnancy and early marriage is very common. The women, they're not even 21 years old by the time they conceive. Their body is not fully developed. They do not have the nutritional resources within their body to cover and provide nutrition required for that unborn child which is being developed. So that's very important, that it's that nutritional status becomes a very big question. So what in this slide, what I've tried to do is just kind of summarize what are those common factors which we need to consider in our head when we are talking to these pregnant women, that what are they thinking. Now this can again be pre-pregnancy or post-pregnancy. So if in case you have a pregnant woman with you, when she comes in, you need to engage with her, understand, see, maybe she might have been coming for some kind of illness or some morbidities associated, but as a practitioner, as a healthcare worker, talk to her and understand what her mental status is, if she has any environmental stressors around her, something that if she's willing to be even a mother or not, what kind of stress is she undergoing. Then as healthcare professionals, check her nutritional status, which is very, very important. If it's not right, either if necessary improve the nutritional status, and if you see that there might be associated complications which are foreseen, which will eventually lead to probably maternal death, you have to suggest that if there is a need for abortion. But that is only something that comes up in the very severe stage where you need to consider this. But at the first go, when you look at a patient and you look at a pregnant woman, understand from her nutritional status, if there are any underlying diseases. You will anyhow be getting the age of the mother, try understand her socioeconomic status, her surroundings, those kind of things, because these are common risk factors. Even like in Bihar and UP, what we frequently see is there's still a predominance for male child, although things have improved so much, but there's still a lot of predominance for male child. So sometimes when that doesn't happen and a girl is born, so the mother goes into that postpartum depression, because that child, whatever gender she was expected to deliver was not done. Those are again risk factors for her to develop such mental health disorders, have depressions, anxieties, and probably she can also, it might lead to death. So it's also found that her relations within her family, conflict and domestic violence, those are other factors which also affect the health. So according to one of the studies, it was found that women who are exposed to partner violence have a 3 to 5 times higher risk of developing such maternal mental health conditions, where it might be related to anxiety, that feeling of hurting the child, racing thoughts, trying to escape. That's very common. So when we are looking at such a patient, when we are looking at any mother, we need to understand what are their, or what is her nutritional status, what is her age, what are her surroundings. Maybe in the first go, she may not be open to discuss for such things. People are not that comfortable. But as healthcare workers, it is our duty to interact. Like when we have those antenatal visits, when they come to us, we should make sure that we understand their synchrony in their life with their partner at their home, and then if needed, suggest accordingly what she requires to have that mental well-being. Because it's again not just during those 9 months or during those 1 year after pregnancy. This is a long-term thing. Mental health is something which is like it goes around in and every single day. You cannot escape that part. Someday when you are not doing well, it's okay, but that constant lingering thought of guilt, weakness, fatigue, depression, that will eventually affect your health, and it might have a larger consequence. So as healthcare professionals, we need to understand these symptoms, and in the very initial stage, instead of providing some therapeutic aspect to it, we should try and go ahead with the preventive aspect, engage, counsel, suggest what can be done and help those people. Moving to the next slide, as I was talking that what are the implications of such maternal mental health disorders on women. As I said earlier, such things can definitely impact women. It can lead to maternal morbidity and mortality. Sometimes when the situation is not really in a very good state, and female is not in a very good state, a lot of them commit suicide. So again, another report suggests that suicide accounts for nearly 20% of postpartum deaths. So, and that's not just in low middle income countries, that's also in the high income countries. So what happens is, again, you see such patients who are battling through depression, when they cannot have that control over their thoughts. It is that instinctive action to go ahead and limit their lives. That escape mechanism works, and they just want to get rid of it. So that is how that cycle goes. So as healthcare workers, we need to understand that individual and see why it is important. We should tell them that why it's necessary that their mental health, their well-being, just not physical, the mental aspect of it is also very well maintained. So if you see, there are certain other implications as well. So it's, as I said earlier, that most of these perinatal mental health problems often go undiagnosed because they are very trivial. They're like mostly fatigue, poor sleep, not having the willingness to eat, those kind of things. So people usually skip it. Even the pregnant women skip it. But what happens is, the minute you do not have a proper nutrition or you do not have proper sleep, it affects your overall health status. During your pregnancy, it creates a complication of preeclampsia, that's again related to high blood pressure. It can lead to preterm labor, and then having a low birth weight child. Now that again, low birth weight child is a long story of having that low birth weight child is prone to having many kinds of diseases, and those low birth weight children are amongst those that are at a higher risk of under 5 mortality. So what it leads to is, if the mother is not well, it's either that she might commit suicide, she might try to end her life. And since her well-being is not maintained, the child which is born is not having proper development, not having proper nutrition, which again might affect the overall health of the child, and probably lead to again another under 5 mortality. So what we are trying to do, trying to save a child, trying to save a mother, is rather going in, it's a waste, because neither the mother is saved nor the child is saved. So it has a dual implication. The maternal mental health is thereby very important. It's just not affecting the status, the mental health of the mother, it's also affecting the child, the one which is not born yet. So when such mothers, if they are not having the proper mental health status, they are also less likely to receive those antenatal and postnatal care. They are less likely to adhere to this regimen. Now, this again can be a very important point for us. Suppose you have some patients who are coming for antenatal checkup. Probably if they miss once, twice, that's acceptable. But as per the minimum standards of having 4 antenatal checkups, if that is not done, or maybe one is done and remaining are not done, that means that there is some associated concern which needs to be rectified. So as healthcare workers, be it whatever profession we are, we need to identify such females, interact with them, and understand that why haven't they come, and if needed, we should go and visit at their home, provide them that counseling. So what happens in the public health side of it is, you have those ashas, ANMs, who are incentivized to visit at the homes and provide these antenatal checkups. That is why they are allowed to engage with the community, interact, and provide that necessary information. The other thing again, which is implication of maternal mental health, is such women, if they do not seek proper treatment, if they are not dealing with their health, it eventually affects that entire indicator of the development. Again, the maternal morbidity, maternal mortality, neonatal mortality, infant mortality, all those things. So as a country where we are trying to look at those numbers, quantify how we are doing well, that again goes for a toss. So this is just on how the implication of mental health is on mother, what needs to be done from our end on a broader side, understanding and identifying such patients who may have that risk of developing mental health conditions. But now what happens when, what is the implication of that poor mental health of a pregnant woman? How does it impact children? So that is what I've talked about in the next slide. So as I was saying that, if such children are born, they they are born at a preterm phase. They are having that chance of having a low birth weight. They are at a higher chance or at a higher risk of having malnutrition and stunting, diarrheal diseases, other infections because their immune system is not so well developed, higher rates of hospital admissions, and missing out on their immunization schedules because they're so often so ill. So all those things eventually combining together to have an overall detrimental effect to the health of the child. And since this immunization happens, most of it happens in that less than 5 years of age. But what we see is that in such resource constrained settings where the mother was impacted, where she did not have a proper physical and mental status, her child is at a higher risk of developing such conditions, probably having a lack of physical cognitive development, and that in turn affecting the overall health, and probably in some cases leading to death as well. So as I've been saying, this is where it's like this this proper circle. If you see, as a woman, we are born, we grow from toddlers to children, and then adults. There's somewhere that phase of teenage, and our life progresses. So at any given point of time, if you see, your mental health at every stage is important. It's just when you're born, how your family is, how you have interacted with your family, that is your support system. Okay. So if that is strong enough, you have had proper parenting, you have received proper parenting, that leads you to understand that, how as an individual you should develop. And then when you grow in your life and you make your choices, when you are deciding that, okay, fine, I have to be a mother, you take into account those things, that how your parents treated you, how was your surrounding, how physically, mentally, emotionally well established, or well uh, stated you are in your situation, how is your well-being, that whether you are in that state of giving birth. So that is where, if all these things are satisfied, that's where it leads to you having that thought that, okay, fine, I am mentally fine, I am physically fit to have another life. Because at the end of the day, it's a new responsibility. It's just not you, your health, your well-being is going to impact your child as well. And there are a lot of studies which always say that the parenting that you have received is eventually an impression of you which you are going to reflect on your newborn. So that in turn will show that how your mental health conditions are, or how you have evolved mentally. That is going to create an impression on your child. If you are doing well, if you are mentally healthy, irrespective of whatever stressors you have in your life, if you are having that proper wellness, mental state of cognizance is there, and you are stable enough, you will be able to handle your child throughout his or her well-being, and then help them be better people, and also support the community. So this is like an overall cycle. That's how it goes. So it's not just one phase that we all are looking at. We are looking at from the beginning, from that inception to throughout the life.